All right, hello everyone. Thank you so much for being here. My name is Paatrick Kelly, and I just want to say how moved I am by all of the presentations that came before me. There's just a great sense of the work that has been done, resilience, and the work that needs to be done, and so I'm excited to have dialogue with you all. I'd also like to thank these folks for the invitation to be here to discuss the way that U.S. policy has impacted drug use research and public health. And so a little bit of background about me. I'm currently a fourth-year PhD candidate at the Brown University School of Public Health in Behavioral and Social Health Sciences, which is in Providence, Rhode Island in the States. But it was really in Philadelphia where my passion for research began. Like far too many of us, my family has been impacted by the overdose crisis. And this lived experience really shaped my research interests in terms of understanding how factors beyond individuals ultimately shape the choices people make when they use drugs. And so this informed my research focuses on structural and psychosocial factors that shape how people make decisions about their health. And I primarily explore this among people who use drugs and people who are LGBTQ and the intersections of these groups. I use mixed methods designs that combine qualitative methods with computational techniques like machine learning to investigate my research interest. And so a little bit ago, I mentioned that I'm from Philadelphia. And so Philly is home to the Kensington neighborhood, which many regard as the largest open-air drug market in North America. And so for several years, prior and during COVID, I worked in a research lab that ran studies in partnership with Prevention Point Philadelphia, which is one of the largest syringe services programs in the States. And it was in Philadelphia that I began to see the effects of a veterinary sedative called xylazine, which you may have also heard called tranq, take its toll on the health of people who use drugs in Philly. And so ultimately, xylazine became the focus of my dissertation research as it rapidly emerged in the unregulated fentanyl supply. So xylazine is most commonly used with fentanyl and is associated with major health harms. So xylazine complicates overdoses because naloxone doesn't reverse its sedative effects, and its association with prolonged sedation increases people's vulnerability to theft and assault. Xylazine also causes severe and painful skin wounds and worsens fentanyl withdrawal by making symptoms last longer, and it has complicated buprenorphine initiation. At the same time, limited hospital testing has made it hard to identify who's exposed, leaving clinicians without clear guidance and patients without appropriate care. And so these challenges have really occurred alongside stigma towards people who use drugs, which deters many people from seeking help. And so the result is this widening gap between public health systems and the on-the-ground reality of what's occurring. And so it is this gap that shaped my decision to focus my dissertation on improving xylazine detection and care. And so when I was searching for funding opportunities that would allow me to study xylazine, the Biden administration at the time declared xylazine an emerging public health threat, and the National Institutes of Health issued a call for research that explored the biopsychosocial impacts of xylazine. And so I applied via a grant mechanism called the F31 National Research Service Award, which provides funding for dissertation research and training. And so this is a mechanism that's been in existence for decades in the States, and it has helped to launch the careers of thousands of scientists. The F31 grant mechanism has two key pathways. The first is a standard pathway, and then there's a diversity pathway, which is reviewed the same as a standard pathway, but also considers the demographic backgrounds of predoctoral trainees to help further diversify the scientific workforce. I was eligible for the F31 diversity mechanism because I'm from a socioeconomically disadvantaged background. And so in 2023, I applied for an F31 diversity fellowship, and I was awarded one in 2024. The title of my fellowship is Community and Big Data System Approaches to Identifying and Understanding the Health Impact of Xylazine. My dissertation blends qualitative research with computational methods applied to electronic health record data to create a machine learning model that can predict if someone's been exposed to xylazine. And so this grant that I received supports my dissertation and professional development. The dissertation consists of 3 studies, the first of which is a critical review of stigma and the use of novel adulterants in the drug supply. Studies 2 and 3 are connected through an exploratory sequential mixed methods design. Study 2 consists of qualitative interviews with people exposed to xylazine, as well as healthcare providers who treat xylazine-exposed patients. Study 3 builds on this formative work to create that predictive machine learning model using some natural language processing on electronic health record data. And I also want to emphasize that these fellowships are really important, not just because they provide funding for research, but they help to provide training opportunities for the fellows across diverse training areas. And so in the first year of my grant, I completed significant milestones advancing my research. I completed all 37 interviews for my dissertation, I published 2 first author papers, and I was appointed student editor of the American Journal of Public Health. My fellowship also importantly afforded me the time to have more of a non-research focused presence with my local community. And so I was able to have expanded capacity to do things like go along with service outreach and help with fundraising efforts for 2 of our local housing and harm reduction organizations in Providence, Rhode Island. And so I point out my progress to note that I made good on the contract that I entered with the US government to answer the research questions that they agreed to fund. So you can imagine my shock and disappointment when I, along with all the other predoctoral students who received an F31 Diversity Fellowship, received a termination notice for our research in May of this last year. And so here I've reproduced an excerpt of the termination language that came in the form of a revised notice of award. And so you can see on the slide, I want to point out the text in red. They say, research programs based primarily on artificial and non-scientific categories, including amorphous equity objectives, are antithetical to the scientific inquiry, do nothing to expand our knowledge of living systems, provide low returns on investment, and ultimately do not enhance health, lengthen life, or reduce illness. So they go on to say that no additional funding will be awarded for the project. And so aside from the fact that this official communication from the US government is not only unscientific and hurtful, the termination actually ignores the aims of my research, which is not even within the research areas that the current administration would consider unfavorable. And so this means that my termination targeted my identity as a first-generation low-income student to justify the termination. And I do need to note that since the termination came to those of us in May, the Supreme Court of the United States ruled that the NIH directive that was used to issue this termination is actually illegal. So although the language is not currently in effect, I included it to illustrate the reality of what happened to us. And so this is a timeline that I've included here to represent the milestones related to applying, receiving funding, and then navigating the termination of my grant, which is a similar timeline to other folks who've received this funding. I want to note that the timeline doesn't actually reflect that while all of this was playing out, I also needed to continue my research and training. I had to navigate being principal investigator of an NIH grant for the first time, while also navigating a termination, which most PIs never experience in their careers, let alone for their first grant. And so this summer, I was fortunate to have representation to join a lawsuit through the American Public Health Association against NIH to restore funding of terminated grants. A federal judge in Boston actually ruled in our favor, which reversed the terminations for some of us, and that resulted in our terminated grants being reinstated. And so this was a welcome development, of course, because it meant that I can continue my work. But the Trump administration then appealed this federal decision all the way up to the Supreme Court, which ruled that the directives to terminate the grants were illegal, which was good. But the way that they actually issued their ruling does leave a pathway open for the Trump administration to re-terminate our grants under new strategies. And so we're not in the clear just yet. And so amidst the wave of emotions that I felt when reading my termination notice was the sudden realization that what was like the high point of my doctoral career was now the low point. I honestly felt embarrassed to receive this termination. I felt sick thinking about just the contents of that termination notice and then thinking about all the other scholars and the communities that they serve that were impacted by these terminations. And so I did a quick analysis on the 10th of this month of grant witness data, which indicates that 392 F31 grants have been terminated, which has disrupted the academic progress and career development of as many scientists. And because of how these terminations are reported, it's actually not possible to determine how many are diversity awards. But the total funds that were lost is over $31 million. And of these terminations, 27 were funded through the National Institute on Drug Abuse, with a lot of really cool and innovative projects, some of which I've highlighted here, like developing an early warning system for overdose, or working to provide harm reduction service delivery within hospitals. And so I lost several things that were really meaningful to my progress as a trainee because of this termination. I lost financial independence from the university to focus on my work and the valuable time that I could have been spent focusing on other training goals. There was also just a lot of mental energy that went into figuring out how to move this forward, navigate a lawsuit, navigate a federal grant appeal, and then thinking through possibilities of reapplying. But through this experience, I learned a lot. I learned the importance of diversifying funding sources and how to engage with the media, to communicate about the importance of research clearly and responsibly. I learned how to lead into uncertainty, to use it as a space for scientific inquiry and strategic thinking, and it ultimately gave me opportunity to kind of rethink how I approach my research career. And so there's many thoughts that I have about the path forward, given these funding uncertainties, but there's 4 key ones I want to emphasize. The first is to create contingency plans for future terminations that will ensure that researchers can actually make good on our funding commitments to participants and our community partners, so we don't leave them hanging should our funding be pulled. So in my case, when I put in the grant, I made sure that funding for my participants and community organization came from a pot of money that was separate from the government. And so I was able to get everyone paid and compensated for their collaborative time. And so in the US context, we also need to decrease our funding reliance on NIH and our institutions. A looming challenge is that private grants typically don't fund at the same level that an NIH grant can support, though. We also need to train doctoral students in how to navigate crisis situations and prepare them to speak with the media. The field is really unprepared to effectively communicate about the challenges that science faces. And lastly, although this has always been important, it's especially critical now that we conceptualize science as a tool for advocacy. Sadly, research findings are really being weaponized in ways that we thought impossible, and so we must produce science and do so in hand with community with a constant eye towards implications, both intended and unintentional. Researchers can also act as advocates, and so here I've included a QR code to a really beautiful advocacy toolkit created some of the folks that I know at the Drug Policy Alliance that can be used when helping to advocate against funding cuts. And so with that, I'd just like to thank you all for your time. My contact information is here if you'd like to keep tabs on my research or stay in touch. So thank you.